Thank you so much for joining us for Webinar Wednesday. I'm really excited to have our guest speaker, Kevin Coughlin, join us. I will introduce him in just a bit, but first, I'm going to give a super high-level overview for Respite Care Association of Wisconsin, just let you know about some of our grants available for family caregivers and organizations, as well as some free training that we offer for family caregivers and respite care providers. And I want to update everyone on the Wisconsin Respite Care Registry. Then I'll turn it over to Kevin. So without further ado, I am going to share my presentation and let's get started. We always have a mixed crowd for Webinar Wednesday. Sometimes people have joined us before, sometimes they have not. So I try to do a good balance of not getting super in depth of our things, but also just informing people about what we do have to offer if you've never heard of us or you've never joined us before. And then you can you can interrupt me. And if you have something when I'm talking, feel free to interrupt and jump in and ask a question. You can type in the chat. You can email me afterwards. So just please know that everyone can get a hold of me however they would like, and I'm happy to answer questions. Just want to make it known that we are a nonprofit and we do serve all 72 counties and tribes in Wisconsin, in the 11 tribes, I should say. And we do serve families caring for loved ones on the lifespan, so birth through end of life. Respite care, sometimes it's planned. Sometimes it's on an emergent basis. It completely depends on so many variables, but we are able to help families and individuals regardless if it's planned respite or emergency respite through our grant program. I think it's really important to point out that respite care, it really is a critical public health intervention. It really, truly is. If family caregivers don't take the break, if they're not proactive in getting the break and they're reactive once something has happened, it can really cause a lot of health issues for caregivers when they're not getting that break. Oftentimes they're isolated, they're depressed, they're anxious, they feel completely overwhelmed. So it really is important for family caregivers just to be proactive and take that break. And we'll get into some ways how our CAW breaks down those barriers. Lots of benefits to respite care and to getting that break. I did mention the word isolation earlier. Lots of health issues can stem when people are isolated, and when they get that chance to get out and rest and refresh and recharge, if they choose to hang out with their friends, family members, other loved ones, they can really increase their social engagement. The other really important thing is we are seeing more and more at our CAW, there are a lot of mental health crises going on with family members across the state. By the time they call us, it's usually most of the time in the last few months, it's already been a level 9 or 10 with how emergent or what's going on with their mental health. And oftentimes they turn to things that might not be healthy for you, so it really can prevent bad habits. Sometimes they use other mechanisms to cope. So I'm not going to read all of these to you for the sake of time. Happy to share the PowerPoint. But if you are a professional working with a family caregiver and they're hesitant on taking that break, this is a flyer that we do have available and some talking points for you, trying to encourage them to get the break that they need. Once we approve a grant for someone for the Caregiver Respite Grant Program, we ask them to do a survey. And these are the challenges that most family caregivers are facing. Now, none of this is new to anyone, I'm sure, on this call, but I do think it is very important to point out how much of invisible population family caregivers can truly be and what they're feeling, what they're dealing with. This is also some other great data that we love to collect. We love to see what people are doing with their time when we approve a Caregiver Respite Grant Program application for them. Families get to spend time with other family members. They have time basically to do what they want. If they want to sleep, if they want to read, if they want to do something that of interest, they get to hang out with their friends and be social. A lot of times if they're caring for an adult child or a younger child, or perhaps maybe an aging parent, they take that break and they get to hang out with their spouse or their partner, significant other. Sometimes people need respite care because they need time to get stuff done around their house. It's not super often, although we'd love to see it, that the primary caregivers are using respite care to go on some amazing vacation. A lot of times it's because they have to meet their own medical needs and truly get things done around their home. And that is going to bring us to our next slide. A lot of times there are barriers. There's barriers for professionals working with family caregivers. There's barriers for maybe, let's say, an adult child who is trying to convince their mom who's taking care of their father to take that break. And I'm going to show you how our CAW, we break down those barriers. Caregivers, they can be too proud to accept help. Maybe they think it's their job and this is, it's not right to hire someone to care for their loved one. One of the biggest problems, there's a lack of respite care providers. Sometimes families just don't have the funds available to pay for respite care. And sometimes they don't trust someone from an agency, or if they might not be comfortable with someone they don't know quite yet coming into their home the first time they want to take that break. And like I said, I'll show you how we break down those barriers. Something that's really important if you are a family caregiver or if you work with family caregivers, respite care is just as much of a benefit to the care recipient as it is the caregiver. Obviously, if someone we saw earlier with the data that we collect, they're overwhelmed, they're tired, they're anxious. I know when I'm overwhelmed, I'm tired and I'm anxious, I'm typically not pleasant to be around. So I can only imagine that a care recipient would feel that energy and feel that coming from me and feel that in the room. So when they get a break from us, it's just as beneficial to them, and they get to do meaningful activities with a respite care provider. And like I said, it really is important to be proactive versus reactive. And then I will kind of carry through those barriers and how we can break them down as I go through these slides, and then I will turn it over to Kevin. I do want to mention that we do have a free online training. It is on our website, www.respitecarewi.org. It's called the Respite Care Provider Training. And this is essentially, it's to increase the pool of trained respite care providers. People can start and stop as they wish. And when they're done, they get a certificate of completion for 7 hours. And then they have the option to be listed on the Wisconsin Respite Care Registry, which I'll talk about in a second. These are the 10 courses that are in the respite care provider training. General overview of respite, disability, meeting with family caregivers, professional ethics, interpersonal skills. We also have some online courses. Once someone completes the respite care provider training, we have had them say, okay, so I finished the training and I'm on the registry and I'm not getting calls or I'm not getting clients. So we do have other courses they can take. Everything we do is free. We don't charge for anything. Being a nonprofit, we have how to market yourself as a respite care provider and also becoming an independent respite care provider. We have a course for family caregivers, and we have, it's called the KIT, Knowledge Idea Tools for family caregivers. So like I said, oftentimes they might be resistant to hiring someone, and it can be overwhelming. Now you have to find someone, now you have to hire them, now you have to train them. And this is also on the website, but what we did is we pulled the pertinent documents out of this course, and they're simply PDF links embedded into our website. If a caregiver is, like I said, overwhelmed, tired, anxious from all of their caregiving duties, possibly the last thing they want to do is take an online course. So they can go to our website and download the materials. It's interview questions. It's just how to run a background check, things to do when you give a tour to the house or to give a tour for the house, and just general oversights of things that a lot of times family caregivers don't know. Now I'm going to stop sharing really quick and make my colleague a co-host. She just joined, and then she can let people in. All right, we're going to go back Thanks, Les. Appreciate it. Are there any questions so far? All right, let's keep going. We do have some specialized training for people who have either taken the respite care provider training or family caregivers. We have promo codes. Essentially, we cover the cost. It's dementia generalist for healthcare providers. And then once you get that, you can get your dementia specialist. It's through UW Oshkosh, Dementia Capable Wisconsin. I've gone through all of them. They're very great courses online. You can start and stop. If you know of a family caregiver who is, we do provide supports for regardless of age. However, if you know a family caregiver that's caring for someone living with memory issues, we do have the availability to hook them up for no cost to them to take the dementia generalist for friends and family. All right, the registry. I mentioned that earlier. It is predominantly individuals who have taken the respite care provider training and can be listed on the registry. There are some agencies that are listed, not all. It's agencies that have reached out to us and said they have the availability to take new clients. We do have a registry compliance. Every 90 days they need to indicate. So I want to back up. We are not the employers of the respite care providers. We essentially, just going to let Pam in. We essentially provide the training and we provide the registry, which is a bridge to connect people who need respite care to those who provide respite care. So like I said, every 90 days, they need to verify that they need to verify that their contact information hasn't changed and that they're still willing to provide respite care. And then it is up to the person hiring them to run the background check on them. And we have information how to do that. So essentially, it's a consumer-based site connecting people who provide to people who need. This is an example of what the registry profile can look like. This is someone in Barron, Rusk, Washburn. So when you search the registry, you'll search the county in which you live, the age of the care recipient, and it'll list the ages they're willing to work with, the hours they're available. And you can see here on the screen everything that is listed and their contact information and how to get a hold of them. All right, let's get into grants. Our Caregiver Respite grant, essentially, I'll just super high level, anyone would be eligible. It's not based on income. However, we do ask for supporting documentation either from the ADRC or from the county, depending on the age of the care recipient, stating that the applicant has tried something else first or they're not eligible. Now, when you see the long-term care waiver supports or other grants, we're talking NFCSP, AFCSP, Family Care, IRIS. We also help kinship, so potentially a relative caregiver, and foster families. So we just need to know that they've tried something else first or they're not eligible. One of the ways that this helps break down some of the barriers we talked about earlier of affordability and lack of providers is this pays for 5 days of respite care within a 30-day period. And RCAW has no preference to who provides the respite care. The applicant is more than welcome to hire a friend, a family member, someone that they know. They also are able to hire someone from an agency. It's completely self-directed by the applicant who is hired. We simply provide the funding, but like I said, we do need that supporting documentation from the ADRC or the county, just stating that they've tried something else first or they're not eligible or they've been waitlisted. The core grant program, essentially this is for agencies and organizations. They can apply for up to $3,000 and they can do events. They can do in-person events. Through the pandemic, RCAW did allow virtual events to be an allowable expense, and there's a very diverse list of things that people use these funds for. But essentially, if it's going to help recruit or recruit more respite care providers, or it's going to provide information to family caregivers, it's an allowable expense. And there's some really great things that come out of these events. We have a group respite grant program. Essentially, it is exactly what it's called. Typically, applicants are support groups or different memory cafes, or there's different organizations. There's a Wisconsin, a camp in Wisconsin. It's for siblings of kids living with disabilities. And essentially an organization, a lot of times the barrier to family caregivers coming to an event is they don't have respite care or someone to provide that help for them. So they can hire an outside agency or hire their own respite care providers to do respite in-house while the event is taking place. The supplemental respite grant program, I'm just going to get to this slide. It shows you the allowable expenses, and it's the same eligibility criteria, the same application process as the Caregiver Respite Grant Program. The only difference are the allowable expenses. It's $250 every 180 days. You can get up to $500. Previously, we used to do $250 every 90 days, but now with the extended outreach that RCA is doing, and the more and more people are learning about us, the more our grant programs have grown, and the demand is huge. So we did have to scale back. So it's 250 days, $250 every 6 months. And typically people use it for home modifications, housekeeping, lawn care, snow removal, things that can take the load off of them while they are taking care of the care recipient. This is my contact information. I can type that into the chat, but I'm going to stop share for a second and just check the chat, see if there's any unanswered questions, and then I'll turn it over. Ooh, I see you're popping. Okay, great. Kevin, I just saw your message now. You were the host and you got to let people in the waiting room. Thank you so much. All right.
You're welcome.
That was really helpful. I am going to spotlight Kevin, and I would love to welcome him while he gets his screen up and sharing. Kevin, hopefully you cannot hear my dogs barking. I apologize. But our guest speaker today is Kevin Coughlin. Kevin is the Policy Initiative Advisor with DHS Medicaid Services, and he is going to talk to us about some ARPA funds and workforce and innovation grants. Kevin, thank you so much for coming.
Thanks, Rachel. It's just a real pleasure to be here. And, DHS is a huge fan of respite. It's just such a great program that allows, many people to live in their own homes, to live in their communities, to really choose where they want to be, and gives that, really good respite to those caregivers. So really thank you so much for allowing me to talk to you today. So, I think, we just want to kind of go over a little bit, we're in a crisis, caregiver crisis, and I think you all know what's going on. It's there's so many vacant positions. We're going to need more and more caregivers as we move forward because of the sort of the aging of our society, and just the turnover that we're starting to see. And this didn't even reflect sort of the whole pandemic, and what we're seeing from that. And the big, a lot of people are quitting their jobs and just going into different occupations. So there's so much stress on having enough caregivers to meet the needs. And, in Wisconsin, we have over 100,000 beneficiaries that are utilizing our long-term care system, from children through adults, and it's just, like I said, it's just going to grow as our communities continue to age. So the goal so if I can just back up a little bit, the American Rescue Plan Act was really allowed us to infuse, I think it's going to be up to $750 million to improve our home and community-based services. So home and community-based services, when we think of that, it's all those people that are not kind of living in an institution and are living in homes, supportive apartments, our family members, are the caregivers. So, all of those people we can help support. And we've had some difficult budget times where we've had a lot of great ideas where we haven't been able to move it forward because of really tight budgets. And now we have this program. It's a short time. We only have it through 2024, but I think we can make some big impacts. So one of the projects is workforce. We're going to try to reform and improve our workforce and do some things with this crisis that we're under. And we also want it to be not just a Band-Aid. We could throw a lot of money at things that will kind of solve a short-term problem, but I think we have the opportunity to really look long-term and to see how can we affect some of the systemic issues out there. So we want to improve competencies. If you're not, at the CNA level, certified nursing assistant, working in a nursing home or hospital or a home health agency, there's structured training, there's competency. People kind of know what you're getting in a person that's going to come and work for them because they've met these fairly rigid requirements. So all the caregivers below that, people that are doing work in respite, that are doing work in adult family homes, assisted living in people's homes, working for a self-directed person who's directing their own care. All of those are sort of a mixture of some administrative codes and policy. It might be a managed care organization contract requirement. So there's a litany of different ways to get training. And a lot of it is, kind of meet the needs of the client or the participant that you're working with. So what we're hoping to do here is really create, almost like a universal worker where somebody has some really good training where they can kind of work across a lot of different areas in our home and community-based services, but also to establish a pathway for advancement. Once you have competency and you have a registry, that allows you to start thinking about a career ladder where another entity will recognize sort of where a person is in their journey in training and competency. So that's what we're hoping to create, this portability where people can kind of move from one agency, one entity, one participant that's directing their care to others and have really these good competencies to move forward. And again, kind of the big picture is we want to continue to support people and where they want to live and improve that our services that we can with the home and community-based system, decrease our reliance on long-term care, institutional care, and then also a lot of this, the research shows if we can support people where they want to be, where they want to live, it's also cost effective. So how can we do that strategically? So the programs that we hope to benefit from our workforce initiative is our children's long-term care, family care partnership, our IRIS, which is our self-directed program, and PACE and partnership. So we have sort of three big buckets of work that we're going to try to do with this workforce. And one is looking at a staff stability survey. And what this is to help us understand sort of what is the landscape of our wages, our benefits, turnover, what's going on. There's some national data out there, but it's not real great, and it's not Wisconsin. So we really want to find out where is Wisconsin at with all of this information. So we are doing a number of areas to obtain this information. We're kind of looking at the low-hanging fruit was our first effort, and there is a adult with people with intellectual and developmental disability staff stability survey. So it's out there already. It's I think there's like 26 states are already participating in it. It is also part of our subscription fee that we already pay the National Core Indicators because they're doing a lot of other survey work directly to participants. So it was easy, it was free. It looked at a lot of our a group that we serve a lot of individuals. So we did that. We kind of sent out some information in February. We had 2 informational webinars in March. Those are recorded and are available if people are interested in seeing those. And then in April 11th, we opened the portal. So the people that we identified as serving this population and would have direct care workers, we sent invitation to participate in this survey. And I think it went out to almost 800 agencies and providers. And then, so they have until June 30th to upload their information into this survey. And it's not an easy lift. And that was one of the concerns that we had. You know, we have a pandemic, we have a workforce crisis, and here we are asking these providers for a lot of information that they have, but maybe they don't have it organized. So we are using ARPA funding to incentivize their participation. And that incentive kind of ranges from $250 to $1,000, depending on the number of direct care workers that they have in their agency. So then, excuse me, we'll be getting that information back. We'll have information that we can look at and analyze about Wisconsin. We can't see individual providers, but we can see aggregate data and, you know, kind of cohorts of people, kind of who they are, what agency types they are. So we'll have several months to analyze that. And then in January of, actually that should be 2023, we will have a national report that it'll compare Wisconsin to other states with, you know, similar populations that they're looking at. So that is kind of phase 1 of the staff stability survey. The next one is we are participating along with, I think it's 4 other states in a pilot for a staff stability survey for adults who are aging and physically disabled. So that'll be another big group of individuals. It's going to kind of replicate what the NCI for IDD population is. So we are participating right now in the design of that survey along with the other states, and it'll be completed sometime this summer. We hope to get this survey out late summer, early fall, and then be able to have data yet this year for that those 2 population groups. And then our adults who self-direct and our children's long-term care, we are in some preliminary discussion right now to see if there's an entity that would be able to do a staff stability survey for these 2 groups. And then at least during this ARPA period, we're gonna at least have that benchmark baseline data with the goal that we'll work this into the budget so that we can do this as we move forward. And like maybe every 2 years, we would run this staff stability survey to see if we're moving the needle at all. Are we getting higher wages, better benefits, less turnover? So we'll be able to sort of measure that, our success. Our long-term goal is really if we could find one survey that would sort of affect all of our home and community-based service individuals. So we would like to have that kind of I think they call it like a smart survey where a provider or agency could then kind of select kind of which groups that they serve, and then certain questions would be customized for that group, but also, probably 80% of the questions would be similar for, anybody that you serve. So that's kind of the goal on that one. So that's a big bucket that's we're kind of in the process of. And the second one is this, what I kind of talked about earlier, to create a sort of a direct care worker professional certificate. This is not probably the title it's going to be right now, but sort of what we're calling it for now. So it would be for like personal care workers, supportive home care workers, maybe people working in small adult family homes or other assisted living potentially, depending on the progress we make with some of the other agencies that do the licensing. So we're not going to require anything new. So people can still meet the current requirements, whether they're administrative code or standards or policy, and continue to be working in the environments that they are working. but it could also allow for, what we hope to get to is this Wisconsin approved certificate that we'll have, and it'll be portable. People will hopefully be able to kind of move and be recognized for their the level of competency that they have. Also to have a public registry listing. So that's our goal kind of for that program. And kind of where we are in the process is we have actually received, we've chosen an academic partner that we're working on an interagency agreement with right now. And the first thing that they will be doing is kind of convening a stakeholder group to get input. And I'm hoping that that this association will be part of that group that will kind of help us talk about what competencies are important. And you've got some great, you're already doing trainings, a certificate program. How can we leverage sort of what you're already doing while we create this other program? So then they will create this, and it'll be an online training with a certificate program that you'll receive the certificate through a proctored competency test, so that we are assured that people are actually having those competencies to do this work. And there'll be a public registry. And then also the academic partner is going to have do a tracking system that will look at that individual from their training, the tests, the employment and retention, so that we really have some good metrics to see where are these people going? Are they working in our home and community-based services? Are they making an impact? Are they able to be retained because they have really good competencies? So we'll have a lot of that data to help kind of guide us as we move forward. So then parallel with that, what we're going to be doing is we had a very successful program with our nursing homes and certified nursing assistants that we called the WIS Caregiver Career Program. We had a large grant to do that program, and it was a couple of years ago. And so we created a brand which a lot of people now recognize. And what we want to do is expand the WIS Caregiver brand to also include home and community-based providers, so that we can kind of leverage everything that we've already created with branding and a video and videos, and create more videos to really represent this other group of people that are, places like, respite care providers, entities that are, serving supportive apartments, people that are self-directing. So we want to, get some good videos to portray sort of the expanse of opportunities that people will have if they get into this kind of a career. And then there'll be, kind of a website and resources. And then we hope to tie this into our tracking system as we create that system as well. So this is kind of our current logo of WIS Caregiver Careers. So we're gonna, really expand and upgrade the site to include the home and community-based services, training site, participating employer maps, stakeholder pages, tracking systems, a lot of different things like that we could do with that. So then, once we have the certificate program developed, we're going to use that, media campaign to drive individuals to think about this as a career, and they'll come to the website and then, see what opportunities there are. Hopefully sign up for that training and get trained, take their test, and then be eligible to work in one of our settings. And a respite provider could certainly be one of those providers that they could choose. We would pay that individual a sign-on bonus and a retention bonus for them to start working there. So that's kind of our ideas. And then the other thing that we're thinking about, and some of Rachel's earlier discussion prompts an idea that I think we need to work together to see what can we do as we start designing this certificate program, because what we're also thinking about is creating a badging system as well. And what that would do is we could have specific training that a person could take, and then that would be kind of electronically attached to their certificate, so that a person, they know that they're this direct care worker or professional, but they also are badged in in autism training or dementia training, or could it be respite training? Could this program sort of recognize what you guys are already doing, because you have your own certificate program, you have a registry that shows that these people have completed that level of competency. So maybe we can work together to see if we can't badge in that area. And also I'm thinking the UW Oshkosh program is something I was involved with early on when we had that interagency agreement with UWO, and that is really good training. And maybe we can also use that program to badge in that area. So I think there's some great opportunity that we can kind of work together on and get people working across all areas. We want you guys to benefit from this initiative as well. So then the third big bucket is what's called Connect to Care Jobs. And currently, this program came out of sort of the pandemic. And I think it's similar to some of the things that you're doing with your registry. It connects caregivers, job seekers to employers and vice versa. It's kind of like a LinkedIn for direct care workers and other CNAs and other places, and that's been going since I think 2020. Very successful. People really like it. But what they're doing now is they're Advancing States is sort of the entity that owns this product, and they are going to be working with a vendor to really enhance this program. So it'll have it's supposed to eventually be kind of the place to go for everything you want about the workforce. So we would have job postings could go on here, candidate profiles. There'd be a state repository for credentialing, so our new certificate program could be on here. There could be advanced searches, so people can really find the people that they need or the employer that they want. There'd be training, auto matching, and then some collaboration and advanced reporting, so that the state has a lot of good data to see if this is working like we would want. Certainly, we would be interested in linking your directory and your certificate program somehow into this program. So it's sort of all inclusive of kind of what's out there right now existing. So it could be a one-stop all. You'd still keep all your websites and things, but if we could link to you, that'll help somebody that would be interested. And this again could be where people looking for employees could have additional information out here, because we're going to using that media campaign. There's going to be a lot of people coming to this site, because this will also be our WISC caregiver career sort of landing page as well. So this is kind of some of the things that we already have a contract with Advancing States. So we have a membership with them, and we're sort of paying a fee already. So we're going to pay an additional fee to do this program. And what's nice is that then kind of embeds it into our sort of our budget, so that this can be sustained in years to come. The entity is kind of working on the final scope of this project, and then it's going to be a shared service model. So they're going to be working collaboratively with all the states that are interested in joining this. So we're going to be working sort of together on what this will look like and what resources we want on kind of that main page. There's also the ability to potentially customize, if there's something that we want on the Wisconsin page that no one else wants, we could pay some extra to help build that into the program. And then again, we'll have our WISC caregiver career pages embedded into this, so that people aren't going to different places, and our certificate program that we're working on. So once all of that gets done, we also have an idea, and this is going to be a more complicated process, but sort of the vision is, how can we incentivize providers to hire these workers now that we have them at this higher level of competency, and to really encourage these workers to get hired. So not only is the worker getting incentivized with these like a sign-on and a retention bonus, but the provider will as well. So we're looking at, how do we use value-based Medicaid to with our payment models to encourage that? So could we give a higher rate of pay to providers who have, a certain percent of their workforce that are at this higher level? So those are things that, as we're moving forward, we're going to be trying to address. And then also, not on this slide, but we are going to be, exploring, this whole ladder concept. Nationally, there's just a lot of research now that shows that employees want to be able to advance. They want that opportunity. And right now, we're not portable. People going laterally to jobs, a lot of times they might have to get retrained, and they can't advance. They can advance, but they're kind of starting from zero. So we're exploring the possibility of some of these higher levels, like a CNA or other jobs, will they recognize this direct care worker professional? And maybe 20 hours of whatever we end up with could be recognized as meeting some of these other requirements, because we think a lot of this work will be parallel to some of these other jobs. And then somebody coming in might see this job as something that they're ready for. They're not really ready to become a CNA or an RN, but could they move from this position to a CNA to eventually an RN, and sort of see that pathway that's real clear, as opposed to it's out there somewhere, but there's not this pathway to it. So a lot of that kind of work will be going on as well. So I can, how much time do we have yet? So we have about 15 minutes. Rachel, should I stop here for questions before I go on to the grants project?
Yeah, I think that would be great. I just want to let everyone know, I included a link in the chat about continuing education opportunities for those on our registry, because I sometimes forget to make people aware. And Kevin, I definitely think let's have a conversation sometime soon after this to see
Yes.
how I'm sure you're reading my mind. But we
yeah,
do.
I was when you were talking, I was like, oh, this is we got to be talking. So yeah.
Yeah. I'm really glad that we are connecting. Pam asked a question: will DHS be sharing the results of the staff stability survey? Will that be for public knowledge?
Yeah. So the staff stability survey, there will be a report that comes out. So in January of 2023, that the National Core Indicators will be doing. And it is, in fact, I can, do you do a follow-up to these folks? Otherwise, I could look it up quick. If you look,
no worries.
Okay, if you look up National Core Indicator Staff Stability Survey, Google that, and then the 2020 report just came out. So you can look at what the 2020 report looks like, and then ours will be like that in 2021 with Wisconsin added. So there'll be some really good information. The Wisconsin specific information, we just have never gotten this data. We're not sure what the National Core Indicator will give us and what we're going to glean from it. But yeah, I think if we can find some nuggets of information that could come out of that, yeah, I think that's something we could put out publicly as well. So good question.
Okay, great. And I searched the National Core Indicator Staff Stability, so I just popped that link in the chat for everyone.
Okay, great.
And then we have two more questions. Teresa asked, what is the timeline for finishing and implementing these programs before 2024?
Yes. So the staff stability, we'll have that one, the first part of that one done, this year. So that the IDD, and then the pilot for the aging and physically disabled. The goal for that one is to collect that information in the fall of this year. So we'll have completed that one in 2022. And then the staff stability for children's long-term care and the people who self-direct, I'm guessing will be more in 2023. It's just one's going to take a little bit more time to design and get out the door. The certificate program, we are going to be convening the kind of the stakeholder group early summer, and then we'll be the academic partner will be putting that training together in the late summer, fall, with the hope that we would have this certificate program completed by the end of 2022. And then in January of 2023, because you don't want to do a lot of marketing over the holidays. So January is usually a pretty good time to do it. We would do our launch. So we'll kind of do a soft launch probably in December, and then a full launch with a big, huge marketing campaign in January to really drive people that are interested in that program. And just to give you an idea, when we did the WISC Caregiver Career Program with this media company, similarly in 2018, we did it in January. We had 3,000 training slots that we could fund. We ended up getting over 9,000 people that applied for wanting to become a CNA, and we offered free training, free testing, and a retention bonus. So very similar. So that's what we're hoping. And we had to shut that down because we just had too many people and we didn't have enough spots. So we have 10,000 slots this time, and we're hoping that will be a really productive program. So there's a lot to do between now and then to get providers who are interested in receiving these great candidates, and building that website up and things like that. So that'll happen in January, and then if we need to run some more media campaigns, we'll have a full year to get more people in, get through the training, get them hired, and moving forward. And then the Connect to Care job, so that platform, that one is they're hoping to have that go live in April of 2023. So
okay.
Yep.
Perfect. And then just one more quick one. Are we able to, Kevin, will you let me post a link to our website with your PowerPoint so people can download it?
Yep. I'll send you a PDF version so you can easily do that.
I believe you already did.
Oh, okay.
So I think I'm up and running.
Yep.
Okay, I just wanted to check with you. Thank you.
Yep, you bet. All right, so I've got a few minutes left. So we have another big grant that I'm leading, and this one is sort of innovations grants. So what we're trying to do is get money out to people, providers, agencies, advocates, whoever is supporting individuals in our home and community-based service program. We want to help them, similar to what Rachel was talking about earlier with their grants. How do we support people to do the good work that you're doing, and to come up with innovative programs too? Maybe something that we're not even thinking about, that somebody's had a great idea, just hasn't had the money to do it. So it could be a number of things with workforce, COVID, just enhancing our services and helping people get work. Any of those kinds of projects will be acceptable. So these are, we want to keep it pretty broad. Basically, if you're going to benefit a person who is in our home and community-based service program somewhere, you are eligible. You'll be more eligible the more people that you sort of impact. So, for example, an assisted living provider that says that they take Medicaid, but they only take one person so that they can kind of check the box, and then they have 99 private pay people, and they want to build some big innovative thing. They're probably not going to get it, because we have limited dollars, and we want to make sure that we are able to really promote success with as many people as we can. So that, and again, it's sort of all the same programs are eligible: our Children's Family Care Partnership, PACE, and IRIS. So we cannot, we decided not to do it. We could have done it, but running a grant program is really hard. So we wanted to select a vendor who's kind of done this before. So we have sort of two parts of this vendor selection that we did. One is to design and build and maintain the portal, the online system that will accept all these applications and kind of take them through the process. And then we have another that will be doing sort of that operations. They'll recruit people to apply. They'll process the application process. There'll be tools to help applicants to be able to do everything they need to do, technical assistance. And then at the end, what we want to do is to have a grantee summit so that we can really share some of the stories of the successes that we hope to see out of this program. So this timeline is pretty aggressive. We're falling behind a little bit. We were hoping to have the contract signed already, but we have selected the vendor. We're any day now, we should have the contract signed, and then we'll start getting going. We still have the goal to have our first grant period open July 1st. And then we'll have subsequent grant periods after that. And then at the end of the year, at the end of that period, we'll have a summit, and it'll be at the end of that ARPA funding. So the vendor who got the award is the entity is called Public Consulting Group. And they have both of them, which I'm kind of happy about, because there is going to be the need to kind of both processes to be talking with and collaborating with. So it's easier if they're the same entity. So that design is underway, and we hope to see some good results of that soon. So I got a few more questions on the grant program, if you want.
Yeah. Someone, or Trisha Johnson asked, is family care the one who needs to apply for the grant, or the provider serving family care members?
Either one. Providers could do it, advocates could do it, your agency could do it as an association. So there's lots of pretty broad, but I think those applications are going to indicate you're going to have to define what this product is. The one caveat is we do need this to be a pretty short turnaround. Unfortunately, because of how the grant is structured, or how the vendor thing is structured, this money needs to kind of happen. The program has to happen and be completed within a fairly short amount of time.
Great, and thank you for answering that. And where will people be able to access the grant applications? DHS website starting July 1?
Yeah, are you able to, could you Google, go to the DHS, the main DHS website? And I should have had this on one of these slides.
No
I apologize.
I have it for you. What do you need?
Okay, then go to A to Z and look up American Rescue Plan Act. And then you'll see two options, like one is mental health and one is community. You see that at the bottom?
Let's see. Maybe I can just search the website.
I could look that up too. Sometimes
yes, I have it. So mental health. So HCBS, I'm assuming.
Yep. And then put that link in there, and that'll give a link to both our workforce one and the grants. And then there's an opportunity to sign up on our listserv, so you can get notified of any ARPA kind of projects that are going out. So when that first application window opens, you'll get a notification that the applications are open for service, and then any other updates you'll get on there, or you can just periodically check back. And that each one of those, you'll see there's, I don't know, eight or 10 different subdomains of the different projects that we're involved in. So I just talked about two today. There's lots of others that may have some interest that you have. But as these projects kind of evolve, you'll see more and more information on the website. So when you look at workforce right now, it's mostly about the staff stability, because that's the one that we kind of have going out there right now. As we get more about the certificate program, you'll see more and more information. So just, you'll need to check back periodically.
Great. And I did put the link in the chat to that.
Great.
You are welcome, Rachel. Kevin, well, everyone else, if we don't have any other questions, you can feel free to unmute yourself and ask, or you can pop them in the chat. Kevin, I really want to thank you for coming today and sharing this really exciting information with everyone. And I will follow up with you with an email after this, if you ever want to connect and talk through some things. And
Yeah, actually,
actually,
I would really like that. So if there's some people on your team that that you think would be appropriate, I mean, we could either do it right now, or we could do it when we have the academic partner to kind of have that conversation together. So maybe we'll be thinking about that, how to do that.
Yeah,
best.
I would love to loop in our executive director, Lisa, because I know she would love to be looped in, and as well as another colleague of mine, Leslie. So absolutely. So thank you so much, everyone, for coming. Kevin, I'll email you outside of this. And I feel like I'm hanging up today from Webinar Wednesday with a little bit more hope than when I joined Webinar Wednesday. So I hope everyone leaves with that same feeling. And thank you for coming. And you know how to get a hold of either myself or Kevin. Thank you so much, everyone.
Bye. Thanks again.
Bye now. Thank you.